All right, let's dive into something pretty intense today, huh? We're talking endotracheal intubation.
Whoa. Yeah, that sounds serious.
It is. It's actually a procedure, a really crucial one in emergency medicine. And even if, we're not doctors ourselves, getting a grasp on this can help us all appreciate just how intricate emergency care can be.
I'm all ears.
So, we're going to be looking at this medical training document, kind of like our guide for today, and we'll break it all down step by step, the equipment they use, even what could go wrong. Like imagine you're rushing to the ER, can't breathe.
Oh man, that's a scary thought.
It is. And that's when endotracheal intubation, well, it can be a lifesaver.
So it's like putting in a breathing tube.
Exactly. A tube goes right into the trachea so the patient can breathe.
Huh.
But the thing that's fascinating to me is all the prep work. Before they even get to the tube part.
Makes sense. Got to be sure everything's right.
You're telling me it's not as simple as just grabbing a tube and going for it.
Oh, absolutely not. This training document, it lays out all this essential equipment, oxygen, suction, a laryngoscope, different size tubes.
Really? Different sizes?
Yeah, like a whole specialized toolkit just for this one procedure. Men and women even need different sizes.
Wow. I never knew that. And I'd imagine they've got to assess how difficult the intubation might be right before they even start.
Yeah, that's crucial. They have these quick assessments, like the Malampati classification. It basically grades how much of the back of your throat they can see. The more they see, the smoother the intubation should go.
So it's like peeking into someone's mouth and seeing how much of their throat you can make out.
That's a great way to put it.
Yeah.
Then there's this thing called the thyromental distance. It's basically the space between your chin and your Adam's apple.
Oh, okay.
Smaller the space, trickier it can be to get that tube in.
So with all this, they can kind of predict any obstacles they might hit, huh?
Exactly. Like a road map, but with all the potential detours already marked.
Smart. Okay, so let's actually walk through the intubation process. The source breaks it down into 9 steps. Each step with specific things they got to do and things they got to consider.
Lots to remember.
Right. So first, they've got to position the patient just right so the airway's all lined up.
Like creating a clear pathway.
Exactly. Then there's pre-oxygenating. This means giving them pure oxygen, 100%, to get their levels up before they start anything.
Makes sense, giving them a boost before diving in.
Right, like a supercharge of oxygen.
Yeah.
Then comes the laryngoscope. This document, it describes how they hold it, how they move the tongue out of the way. It's wild how specific it all is.
Gotta be precise, It's all about getting a clear view of the glottis.
Glottis.
Yeah, the opening to the trachea, they use the anatomy, these landmarks, to guide them to the exact right spot.
It's like a map of the body.
Pretty much.
Yeah.
And once they see it clearly, then comes the part where they actually make way for the tube.
Okay, so how do they do that?
Gotta move this little flap called the epiglottis. It covers the trachea, so they have to get it out of the way.
Makes sense.
And, there are actually different tools they use to do that, depending on the person's anatomy. It's amazing how personalized this stuff can get.
Huh. Who knew? So then the epiglottis is out of the way. They put the tube in, inflate the cuff, and make sure it's all in the right place.
Precisely. Every little detail counts.
In this document, it really stresses this 30-second time limit for each attempt, and that they have to give more oxygen between each try.
Oh, yeah. Time is definitely a factor here. It shows just how high the stakes are.
Absolutely. And to confirm the tube's in the right spot, they use different methods. They listen for breath sounds, watch the chest move, even use x-rays sometimes.
It's all about being absolutely certain.
Right. Okay, so now let's shift gears a little bit. Talk about the less happy side of things. Complications.
Oh, yeah. Nobody wants to think about those.
I know. But the document, it does list a bunch of potential problems that can happen, like tissue trauma, for one.
Makes sense. You're working in a sensitive area.
Right. And some of the descriptions, they're pretty intense. Like, imagine your lip getting caught between the teeth and the laryngoscope.
Oh, gosh, that sounds painful.
Yeah, not good. And that just shows how careful they have to be. The mucous membrane can get damaged, even the eyes, from the pressure.
So many things to consider.
Yeah. Then there's vomiting and aspiration where stuff from the stomach gets into the lungs.
I don't even want to think about that.
I know. It's scary stuff. And there are even more serious complications listed. Hypoxemia, which is when there's not enough oxygen.
Okay.
Hypercapnia, meaning too much CO2. Bradycardia, a slow heart rate. Esophageal rupture.
Whoa, hold on. Esophageal rupture, that sounds terrifying.
It is, and even scarier. Cardiac arrest.
Wow, that's a lot to take in.
I know, it's heavy stuff. Thankfully, these complications, they're pretty rare. But it really shows just how serious this whole procedure is, right?
Definitely emphasizes how vital those trained professionals are. You know, we've been focused on this one standard method, but there are other ways to do it, like nasal intubation. They use it in some specific situations.
Hold on. Nasal. Like through the nose.
You got it. Instead of going through the mouth, they put the tube in through the nose, and they listen for breath sounds to make sure it's positioned correctly.
Wow. I bet there's a whole different set of challenges.
It definitely has its own unique set of complications, things like nosebleeds and damage to the nasal tissue.
Wow.
You know, each one has its own considerations, and the best option really just depends on the specific situation and the patient.
This is all so intricate. When you think about someone's life being on the line.
Yeah, it really shows the skill and precision of those medical professionals, especially in those emergency situations.
You know, it makes me wonder how much intubation techniques have changed over time. Like, I bet the early attempts were, well, a lot riskier.
You're absolutely right. It's come a long way. Tools and techniques have evolved so much because the goal is to make emergency medicine better and better.
It's amazing, really. This whole deep dive is giving me a new perspective on breathing. Like, we take it for granted, but...
Yeah, we don't always think about all those complex mechanisms keeping us alive.
Right. We've covered so much. The equipment, the steps, even all the things that could go wrong. It's like we went through intubation boot camp.
You've got the basics down, that's for sure. And I think this highlights something important. The trust we put in those medical professionals.
Especially in those moments when every second counts.
Exactly. We rely on their knowledge and training to make those crucial decisions.
Absolutely. If anyone listening is feeling extra curious after this, well, there's tons of information out there. This is really just the tip of the iceberg.
It is. There's always more to learn, but this is a great starting point for understanding this whole procedure.
I agree. So next time you see an ambulance racing by, you might have a new appreciation for everything that could be happening inside.
Think about it, that coordinated effort, the quick thinking, those steady hands, all working to stabilize someone.
It's a reminder that there are people out there dedicated to saving lives, even if we don't always see it.
They really are the unsung heroes of emergency medicine.
Well said. This has been a truly eye-opening look into the world of endotracheal intubation. Thanks for joining us on this deep dive. Until next time, keep exploring, keep learning, and never stop being curious about the world around you.
It's been a pleasure. Yeah, it's a completely different approach going through the nose.
I can only imagine.
It really does have its own challenges. Like with nasal intubation, you have to be aware of complications that are specific to that method, you know?
Oh, like what?
Well, things like nosebleeds, for one.
Oh, yeah.
And there's this thing called nasal pressure necrosis, basically damage to the tissues in the nose from, well, the pressure of the tube.
Yikes. Okay, so both approaches, the mouth and the nose, they each have their own, like, pros and cons.
That's right. It's not a one-size-fits-all kind of thing. You know, the choice, it really all comes down to the specifics of the situation.
Right. The patient, their condition, all that. It really makes you think, like this whole process, it's so intricate, especially when someone's life is literally hanging in the balance.
Yeah, you said it. It really speaks to the skill of these medical professionals, you know, the precision they have to have, especially in those emergency situations. It's pretty amazing.
Totally. And, you know, it's kind of making me think about how these techniques, how they've developed over time.
Yeah.
I mean, I bet the early attempts at intubation were, well, probably a lot more dangerous.
Oh, you're absolutely right. The field of intubation, it's come a long way. Like, think about the tools they use, the techniques. They've all evolved so much over time. It's all about, you know, constantly improving how they handle these emergency situations.
It's incredible, really. You know what? This whole deep dive, it's making me realize just how much we take breathing for granted.
It's true. We don't often stop and think about how complex it all is. You know, the mechanics of it, all those systems working together to keep us alive.
It's pretty wild when you actually break it down.
Yeah.
We've covered so much today, you know, like from the equipment checklist to the step-by-step process, even those potential complications.
Yeah.
It's like a crash course in endotracheal intubation or something.
Yeah. I'd say you've got a good grasp of the basics now. You know, this whole conversation, it really brings to light something I think is important. The level of trust we put in medical professionals.
Absolutely. Yeah. Especially when things are critical and every second matters.
Right. We're relying on their expertise, their knowledge, their training to make the right calls, the ones that can, you know, save a life.
That's a powerful thing. And you know what? If anyone out there listening is like super intrigued by all this, well, there's a whole world of information out there. I mean, what we've talked about today, it's really just scratching the surface.
There's always more to explore, that's for sure. But yeah, this is a great starting point for understanding this whole vital procedure.
I think so too. So next time you see an ambulance speeding by, you might have a whole new appreciation for what could be going on inside, you know?
Yeah. Think about it. The coordinated effort, the quick decisions they're making, the steady hands working to help someone.
It's amazing.
Yeah.
And it's a good reminder that there are people out there working hard to save lives, even when we don't see it.
Exactly. The unsung heroes of emergency medicine.
Well said. You know, this has been a truly fascinating look at endotracheal intubation. Thanks for joining us for this deep dive. Until next time, everyone, keep exploring, keep learning, and never lose that curiosity about the world around you.
Absolutely. It's been great sharing this with you. Yeah, it's true. You know, we talk about the steps and the tools, but it's not just about going through the motions, is it?
No, definitely not.
Like, there's so much human judgment involved, you know? Experience, intuition, all those things play a role.
It's like a blend of science and
Yeah.
art, almost.
Exactly. That's a great way to put it. And, you know, I think that aspect often gets overlooked. It's not just a checklist. There's a real artistry to medicine, especially when you're dealing with emergencies. You gotta adapt, think on your feet, and sometimes just trust your gut.
It's fascinating, really. But I'm curious, like, for those of us who aren't in the medical field, why should we even care about all the details of endotracheal intubation?
That's a good question. You know, I think understanding this procedure, it helps us appreciate what happens in those critical moments, you know? In hospitals, emergency rooms, we often just see the outcome, like someone being stabilized or on the road to recovery, but we don't always see the steps it took to get there.
It's like we're getting a glimpse behind the scenes, right?
Yep.
Seeing all the complex work that goes into saving a life.
Yeah, exactly. And I think even just having a basic understanding of these procedures, well, it makes us more informed as patients, more aware of what's happening when someone needs emergency care.
It's like opening a door to a whole other world, right?
Yeah.
The world where skill and compassion come together to help people in those moments when they need it most.
And that's something worth knowing about, even if we're not the ones doing it.
I agree. This has been such an eye-opening experience, you know,
Mm.
learning about endotracheal intubation. But more than that, just getting a deeper appreciation for what medical professionals do every day.
It's been my pleasure to share this with you. It's always good to stay curious, right? The more we learn, the more we understand, and I think that makes us all better off.
Well said. And to everyone listening, thank you so much for joining us on this journey into the world of emergency medicine. Until next time, stay curious.